Good afternoon, everybody. Welcome. Thank you very much for coming to join us. My name is Louise Schoe. I work for the Department of Social Services in Hobart, and I look after a team called Families and Communities, and with me today is Patricia Hartmann, also from the department. I'll apologise up front. I'm going to use my notes because there are lots of things I want to tell you, and I guarantee if I ad-lib it, I will forget half of it, and you'll walk away and go, why did we do that? We've got a difficult time slot after lunch, so hopefully I can keep you all with me. If not, I'm going to get Patty to sing and dance, so at least you'll have had entertainment while you were here. I can only imagine a number of you actually have questions about DSS and the new way of working and the grants reform process that we're about to go through or are going through. Unfortunately, due to probity reasons, and we're going into a tender process, there's very limited that I can say around that. Happy to try and answer questions for you if you have them. However, I would direct you to the DSS website, as Anthony mentioned this morning. It is the sort of single source of truth. We're trying very much to ensure that everybody has access to the same information at the same time, and that we're in no way enabling one person to be more advantaged than another, which is why we try to do the please don't ask me, let's go through the website, and that way everybody gets the same information. If you haven't received your grant extension yet and your organisation is due for one, don't panic, they are coming. Excuse me, it's just, as I'm sure you can all imagine, a time-consuming process for us to develop them and get them out. So please don't worry, they are coming. The purpose of today's session, I'm going to read this so that I get it right, is to explore the concept of early intervention and what this means for DSS-funded services and the sector more broadly. Good afternoon, please. Come in, make yourselves comfortable. In our day-to-day lives, we don't always have time to sit back and think about policy issues, conceptual thinking, or what is coming over the horizon. So today's session is really about making space to focus on the priority area for the Families and Communities program, which is early intervention. Patty and I are not here purporting to be experts on early intervention, because we're certainly not. But we do have a role to bring relevant people together when and where possible to consider issues facing our target audience and consider possible solutions in the Tasmanian context. So, we've designed this session as a peer learning opportunity where we can draw on the wisdom in the room, collect knowledge and share from each other's learnings. Your job will be to draw on your own experience and to actually say what you think. To give some context, as Anthony mentioned in his speech earlier today, the new DSS Families and Children's activity will refocus on early intervention and prevention. That means early intervention to prevent relationship breakdown, to provide the best opportunity for Australians to fully participate in society, to enjoy strong relationships, and to ensure that children are supported to reach their potential as adults. Prevention not only occurs in early life, but also in key transition points of childhood, adolescence, and into adulthood, and at the onset of behavioural problems. So when we talk early intervention, we're not just talking about children. Research demonstrates that to be effective, early intervention programs must be long-term, evidence-based and comprehensive. Significant savings are created by investing in cost-effective approaches which prevent or provide effective early intervention to address family dysfunction and risk factors for children and young people. Intervening early and helping to prevent people from going down paths that lead to poverty and dysfunction have social and economic benefits. We've brought copies of a number of papers with us today that discuss early intervention strategies and economic impact. You'll notice where there's a front row and then a similar paper behind. The front row is just the executive summary. In the interest of trying to save some trees, I haven't done full copies of everything, and there's probably not enough for everybody. So if maybe one person from each organisation, if you want one, grab it. If you want further copies later, just give me a hoy. The government and the department through its programs is going to emphasise the importance of early intervention, as I've already said, not just being early in life, but providing assistance at the earliest possible point before the problems occur. An example of the government's commitment to this philosophy, the new Relationship Assistance Program is being trialled from 1 July. The program aims to help couples seek support strengthen their relationships, especially at crucial transition points such as moving in together, getting married, and the birth of children. So you can see from the aim of that, it's really at that very first point that we're trying to build opportunities to prevent later problems. So what are we going to do now? You've heard me talk for a little while, so I'm going to hand over to Patty, who's going to run us through the process of how we'll run the next half hour or so. Thank you.
Hi. So we've developed about 9 questions at the back there. Sorry. Not used to being on camera. That sort of discuss a range of issues around early intervention that we thought might be of interest to you. And we thought if you'd like, we'll give you a moment to have a look at each question, see which one resonates with you and something you'd like to form a group around and discuss. We'll give each group about 20 minutes to discuss the question, and it's really a chance for you all to share knowledge and make some friends and that sort of thing. So I think we'll give you 20 minutes and then we'll have about, depending on how much time we have left, some time to just feedback. So you probably need to nominate someone to report back. Yeah, hope you'll find that useful. So if you'd like to maybe just have a look around the back, there's 9 questions, and if you'd like to sort of form groups.
So maybe the first person to have picked a question that they think really resonates with them, just pull it off the wall and take it to a table. If that also resonates with other people, join them at that table. If we find that everybody's interested in 1 or 2 questions, we'll just copy the questions out and share them around. But the idea is really, early intervention is a theory that has been around for a long time. We want you to think about what it means for you back in your workplaces, in your day-to-day practice, and how does the organisation support that. So hopefully the range of questions will give you the opportunity to touch on those. So please have a read, make a choice, start some conversations.
So what gaps exist there, Kim? Do you see any? We've got funding long-term gaps. What about you, Evan?
I suppose in the when, how you said antenatal for where, I suppose that would be before there's a problem, like before, I suppose giving people, you want to give people the tools to be able to manage these things before they become problems in their lives.
Well, it's as early as possible, so as soon as it's identified.
Just flag what the question was that you were addressing and then run through your discussion for us. That would be awesome. And I think we have a volunteer. If you'd like to go first, that would be awesome.
Oh, okay, I'm Edwin. And I don't work in the industry at all. I'm a carpenter by trade, but I'm studying counselling. Okay? So I came in here to learn all about early intervention, but apparently now I'm the expert. So we looked at what gaps exist in the sector that prevent early intervention or don't enable the service provision required. And this is what we've come up with. And my 2 learned colleagues here have mentioned that long-term funding is always a problem, that you have short-term, you get funding and then it runs out because there's no results. I think what the guy was talking about this morning. A lot of it is, I think, education in relationships or in families, and that's where it could be targeted. Going in to see, I think, couples and maybe get free counselling or things like that to help them live life, I suppose, in their relationships. And mentoring for young males, there seems to be a gap there, trying to get there. I think that one of the big battles was there's a resistance for people to actually come out, maybe because they're frightened that they'll be labelled, or that they would be maybe lose their children or something, I don't know, that if they own up to things that it might make it difficult for them in their lives.
Apologies.
That's my 2 minutes.
Yeah, that's 2 minutes, mate.
Okay.
Thank you
I've
very
learned a
much
lot,
for sharing.
thanks.
And hopefully you will continue to learn as the groups share their experiences as well. So thank you very much for going first. It's not always easy. We might just literally go around the room unless somebody is burning to go next.
We'd like to go last.
Go around that way. Okay, we can do that.
Oh, well, well done,
We can
then.
certainly do that.
So our question question was, what does early intervention look like when it's working effectively? And what are the transferable elements? We actually thought all the elements we wrote were transferable. So the things that we thought made early intervention effective were communication, so between all parties and stakeholders, as open, and particularly listening to the voice of the client, so making sure that their contributions are really valued. Protective factors are going up, risk factors are going down. There's really good relationship building. There's a clear purpose to the early intervention, that's really named up, it's monitored, it's measured, and so that there's an exit point for that intervention. That the people involved are reconnected with the community and with the people that perhaps they're isolated from, and hence the capacity building is obvious. That perhaps more for the workers, they're sharing, implementing, developing new strategies, and the families also drawing on new strategies. And we liked the discussion this morning about the parents and having more options other than just shouting at their kids. So things like that are really obviously happening. Programs are supported through resources, personnel and secured funding. And I guess going back to your point, we thought early intervention looks like it's working best when there are long-term programs which can be properly evaluated and implemented. And services work collaboratively, so we're really keen on this. So coordinated services to maximise funding, resources, information shared appropriately between services with consent. There are genuine partnerships in that relationship, so that the early intervention is managed really clearly and effectively. So with all of that is obvious when it's working, and hopefully for any sort of intervention it will work. Well held.
Thank you very much for that. We'll work around. You guys will go I'll talk for a little bit.
Okay. Hi, my name's Jodie, and I'm actually a student, so I'm still learning about all the stuff that we're all talking about today. I was really interested in this question, which is culturally appropriate early intervention. What does it look like? Are there differences that need to be considered? Because one of the units I'm just about to start is about communicating and stuff with culturally different people. So some of the things that we came up with were things like being sensitive to people's background. What else have we got? Yeah, to do informed research. So do research about the culture. Just get yourself in the know and what's different from things that may be done at home for us. Bridging to provide mutual common outcome. So help me out here.
What things can each sort of stakeholder bring to the conversation so that we all reach the same outcome, focusing on what, so we can exit the intervention.
Cool. Thank you. What else have we got? So child-focused and child-centred, family-led. So just really being person-centred, talking to the clients as to what's important in their families and in their cultures. Educational backgrounds. Some of the families from overseas might have different emphasis on education. They might have a really big emphasis on education, or not. Usually they do. What else have I got? Communication. Language barriers. That's probably one of the biggest ones actually, is just different cultures and communicating when we speak different languages. I think I've covered all of them. Yep, okay, thank you. Thank you.
Okay, so our question was, how do you engage early in the life of a problem? So we had the who, where, what and when. So for the who we had anyone and everyone. Customers, so for example we had the example of Centrelink, people come in so they're a customer, so they're someone that you might engage with. Other services, parents and carers, and funding bodies and policy makers. to get funding for priority areas that often go unnoticed or don't have the funding to give them the support that they need. So where we would do it, schools, child health, antenatal clinics, community members, centres, houses and workers, playgroups, parenting groups, the child and family centres. So what? There needs to be knowledge about the services. There's a lot of services out there that people aren't aware of and would access if they knew they existed, but they just don't. Training opportunities for professionals so they're better equipped to be able to refer on and know more information about more services for their clients. Having assessment tools or frameworks that facilitate discussions. Be aware that it takes time and you need to invest time to actually achieve the outcomes that you're looking for. There needs to be easy access to information. You need to provide support. So when would you do it? As early as possible when there's an issue that's been identified, and getting in there before there's a problem as well. So giving tools and information to people. And you need to be aware of strategies, not just for now, but also for the future. So how the people you're working with will deal with the problem if it happens again for them. So helping them to be better equipped to deal with issues that occur in their life. So we do it by listening to people, looking for the triggers, taking a holistic approach, using your networks, building and using relationships that you have with people, ideally with more funding, and an integrated approach where possible, a partnership approach, being inclusive, so not leaving groups out, trying to fit everyone in that possibly needs your help, and be mindful of overwhelming the clients with too much information. We use the example of some people have 10 services that they've been referred to and need to talk to, and it's just a little bit overwhelming for them. So that's what we had.
Fantastic, thank you very much. And now we've got about another few moments, not wanting to overly rush both tables left, but just flagging that we're getting towards the end of our session.
Well, I can do rust. We've got question 6. What's the role of referral in an early intervention framework, noting the value of partners, collaborations and gateways? So there was one suggestion that rather than call it a referral, we call it pathways, and that sounds a lot more friendlier and warmer. And the pathways not just for the client but for the family. The whole family can go along for the ride. We mentioned that Centrelink was a gateway for the social workers there that could refer. There's other workers, and there's also just the agency generally. There's organisational forums like service providers meetings we have in the Northwest. West Coast have got a 2-day forum next week in Queenstown if anyone wants to come. Collaborative relationships between organisations, that's very vital. I work in financial counselling area and we often have people with multiple problems and we refer and even meet together with the other people. I even have lawyers come in to sit for legal advice while we do our stuff. Also schools, child family centres, neighbourhood houses, community houses, they're all means of getting people on the pathway and also means of getting out our information so people know what's available. If you're looking at financial counselling, there's a national number, 1800 007 007, easy to remember. What we aim to do is release the stigma as well, and we could do this by joint collaboration. Where are we up to? Privacy and confidentiality, that can be a major problem when we're swapping between agencies and all that. That's something to be aware of. And also we get information from Migrant Resource Centre and Aboriginal community centres, and we can refer either way, being aware of what's culturally acceptable in those organisations.
Fantastic, thank you.
So we had the same question we did number 6, the role of referral in early intervention frameworks with partners, collaborators and gateways. We only just noticed the butcher's paper at the end. We identified that early intervention could occur not just at the beginning of life but also at secondary and tertiary points of transition in people's lives. that the role of referrals is to be relevant, appropriate, well-timed. The purpose of them is to provide access for people to a repository of relationships, resources, information, and that the role of partners and collaborators and gateways is to maintain engagement through relationships for the client, you know, maybe just not at a point in time, but maintaining connectedness and keeping them contextualised, if you like, on their path. What else did we say? Yeah, I think I've basically just said it all in a nutshell very quickly. Was there anything?
You had a bit of an analogy of peacefully going on the top of the water and then paddling furiously underneath, and that for the family or individual who's getting the support, that the journey is nice and gradual in lots of ways, and it's the back end collaboration of the other professionals who are actually tailoring their services around the client, and the client doesn't need to be part of that process. That's the support system.
That's part of what Michael referred to this morning as the work.
As the work, yeah. So we were just trying to, yeah.
Your duck needed a referral for an outboard.
Well, you know, perhaps the actual river could speed up and speed down. So there was a joint element of participation.
Fantastic. Thank you everybody so much for sharing. I think some of the themes that were recurring around the room, regardless of the question itself, was certainly that idea of no one agency has the solution for a family, that the collaboration is essential, that collaboration doesn't necessarily just mean we work together as agencies, but we actually understand the needs of a family, and we put the services, I'll steal Nerali's words, wrap around the client, that the client doesn't necessarily need to understand that they're getting a family service from here and whatever from there, and they just need to understand that their issues within the family are being resolved to get the outcome that has been desired, and that whilst there are some cultural sensitivities required to understand the backgrounds of people, that in fact the theme of early intervention, a lot of the strategies and what it looks like when it was working well, which was the table up here, actually apply across the board. So we would thank you very much for your time. I will just go back to our purpose, which was to flag that early intervention is certainly going to be the focus for the family and community programs across the board, not just the former family programs that some of you would have encountered under DSS or its former iterations. We hope that you actually learnt something from each other. I would challenge you as you leave us today to actually have a few moments as you wander back down the corridor, what you actually may want to do differently, or something that you heard that you'd like to explore a little bit more, and who you would need to work with to actually achieve that when you walk out of the room. So we would thank you very much for your time and participation, and for choosing to come and talk with us. And we hope to work with many of you again into the future. And if you haven't yet met us, please take a moment to come and say hello properly before you leave. So thank you very much for coming.
And there's some papers at that.
Oh yes, please take the papers.